Good afternoon, everyone, and welcome to today's Way Forward Workshop Leader Lunch Break. We are thrilled to have Melissa Kline join us to talk about caregiving today. And before I introduce Melissa, let's just all of us take a moment and thank the many caregivers who appear on our screen, those who are serving now and who've served in the past. We are incredibly grateful for all that you do every day. So, and a leader among all these caregiving leaders is Melissa Kline. She served on the front line of patient care since she began work as a clinical nurse in cardiac care at MetroHealth in 1998. From her early days of direct patient care, she rose to assume additional responsibilities in administration until now. She serves as a senior vice president, system chief nurse executive at Metro, guiding more than 2,000 nurses and nursing personnel. In addition to this, she teaches nursing practice, care, and empathy as the Joanne Zlotnick Glick Professor of Community Health Nursing at Case Western Reserve University's Francis Payne Bolton School of Nursing. And she previously inspired aspiring nurses as the executive in residence at the Cleveland State University School of Nursing in their Doctor of Nursing program. Melissa is a firm believer that education is the most important determinant to addressing our socioeconomic differences, to promoting our well-being, and eliminating health disparities. So in addition to this awesome responsibility, she lives her service, serving on the boards for the Center of Health Affairs, the MetroHealth Foundation, the Journey Center for Safety and Healing, and for the Ohio and American Organizations for Nursing Leadership. In addition, she serves on the advisory boards for nursing programs at Ursuline and Lakeland, and she has a host of publications on the importance of education and effective leadership in nursing. When she's not being a chief caregiver at Metro, she's the chief caregiver for her husband's son and Weimaraner. And she's a proud member of the Leadership Cleveland class of 2021. Please join me in welcoming Melissa Kline.
Thanks, Marianne, for that really kind introduction. And thank you to all my MetroHealth colleagues that I see I've joined, classmates of my sister's from her master's program, St. Martin de Porres, and some of my former Leadership Cleveland classmates. So thanks today for coming out to support today. So when Rachel reached out to me, she asked me to talk about some of the nursing challenges and needs through COVID and today. So that is the topic for today. So I'm going to go ahead and share my screen with some brief slides. Everybody see that? Yes, good. So let's just take a little step backward to before the pandemic. What were we looking forward to? For those of you that didn't know, 2020 was declared Year of the Nurse by the American Nurses Association and also the World Health Organization. So it was not just an event here in the US, but throughout the globe. And that was to honor the work that nurses do every day in caring for patients and keeping us healthy and taking care of us during our times of need. It was also to celebrate the 200th anniversary of Florence Nightingale's birth, who is the mother of the nursing profession. So we were off to a great start. And then a little thing came along called coronavirus and COVID-19. And we started hearing about that early on in the year. And in fact, before we even had any cases here in Northeast Ohio, Governor DeWine and Dr. Amy Acton were here at MetroHealth just giving a little update about it and what measures were going to be taken here in Ohio and the US to help mitigate this new emerging disease. So it quickly became apparent that while nursing's work is sometimes invisible, it was going to be very important during this COVID pandemic, and also not knowing how long it was going to go on. You'll see the importance of nursing care throughout it. Because of this, nursing has been the most trusted profession for the 20th straight year in Gallup's poll. and that's for their honesty and ethics. And I think that can be seen even from the beginning of the pandemic. While many people were maybe trying to avoid the pandemic, run from it, had the luxury of not going to work or being able to work from home, nurses ran towards where the care was needed. And that's because our code of ethics states that the nurse's primary commitment is to the patient. So even though so much was unknown at the beginning of the pandemic, such as how bad was it going to be, what was the appropriate PPE that was needed, that seemed to change on a daily basis. Was there going to be enough PPE? Would I bring it home to my family? Would we have enough resources such as beds and ventilators and staff? As professionals, as nurses, we ran to that despite the risk that it put ourselves in, and even at sometimes perhaps our family. And we ran to it not knowing how long this event was going to last, thinking it was going to be a sprint. It would be like, maybe a bad flu season, last a few months, and then would go back to normal. We didn't realize that it was going to be a marathon, or even, marathon after marathon, or an Ironman, but we just sprinted towards what was needed. So today I'm going to talk about some of the challenges in particular that nurses have faced, and what we as nurses, as nursing leaders, healthcare leaders, and what you can do to help support nurses going forward, however long this pandemic lasts or for when it ends. So going back again to the beginning of the pandemic, it was difficult to imagine that we would still be here talking about it today. At that time, little was known about COVID. We basically knew it was a respiratory disease, and it was spreading pretty quickly throughout the world. At the beginning of March, we saw our first case here in Cleveland, and the healthcare systems had already been preparing for that for a few weeks. Our infectious disease experts had been watching the emergence of this and watching the data and the spread of it. And so we thought we were pretty well prepared. But things, quickly went from 0 patients to a lot of patients. And so as our personal lives were being thrown into chaos, from parents working from home, spouses working from home while helping kids do virtual school, to not knowing if you could get toilet paper or other necessities at the grocery store, we were grappling with constant new information, supply shortages within the hospital and healthcare system, and that, these would be challenging to navigate on a normal day. So sometimes there is a supply chain backup, and you can put in other things to help mitigate that for a few days till the supply arrives or you find an alternative. But we were looking at massive supply chain shortages or outages, especially like with PPE, as people all over the world needed the same types of PPE. People outside of healthcare panicked, and everybody felt that they needed N95 masks, when really that was most important to have for those caregivers providing direct care. So a lot of the things that nurses were going through were the same things that everybody else was, but it was at a heightened sense within the work environment. People were afraid that they were going to take COVID home to their loved ones. We didn't know what the severity of the illness would be, how many deaths would be dealing with. There was constant communication and policy changes. I see many of our staff nurses and leaders here on the presentation today, and they can attest to this, and nobody felt it more than them. While it was anxiety provoking for myself and my associate chief officer, nursing officers, nobody felt it more than that frontline staff, because sometimes literally hour to hour, things were changing. Do this, don't do this, wear this. It's okay to wear this for X amount of time. No, don't wear it for X amount of time. It was a lot. In addition, there were policy changes around visitors, site closures, what was essential, what was not essential. And then also just not knowing what was that PPE supply. We went from wearing N95 masks on a case-by-case basis. You wore it, you were in the patient's room. When you were done in the patient's room, you threw it out. Now we were saying, no, we need to wear these longer. And so there was concern about that. And then just, of course, the fear of the unknown. So I'm going to share a little story here that is a little bit more personal from one of actually our aspiring nurses at the time. She's now a nurse on one of our units, but at the time she was a nurse intern. So in late 2019, she became an intern, and then quickly in March of 2020 was on the front lines of the pandemic. Things were changing rapidly for her. She was in nursing school, but she felt an obligation to work and help our staff, our nurses, and our patients out as much as she could. So in the midst of juggling all the changes with her school program, she was working 40 plus hours a week, not just on her unit, but helping out on other units in the emergency room, other floors in the ICUs. What was most, I think, what touched me the most was that this particular nurse at the time, she's an only child. Her mom had been battling cancer, was in remission, but she was very afraid, like we all were, of taking it home to her family. And so for months, she did not see her mom. She FaceTimed with her, talked to her on the phone, but couldn't see her in person, and they were very close. But as a future nurse or now nurse, that for her, you know, her obligation, she felt like her moral obligation was to care for our patients, and she chose to do that. Fortunately, a few months later, she was able to get the vaccine, and so was her mom, and she was able to see her mom 3 times until, unfortunately, her mom suddenly passed away due to another condition. But that's just, I think, really sums up the personal sacrifice that nurses were making when they chose to show up for our patients in our community every day. They really were selfless about it, and put patients first. So after about 6 months or so, cases began to decrease, and there was chatter about a vaccine coming. And we thought finally the pandemic was ending. So this was probably around the end of 2020, early 2020. But as the weather began to get, or early 21. So as the weather began to get colder though, families were tired of socially distancing. People were tired of being apart, not having that social contact. And the holidays hit, families started to get together, and we saw a rise in cases again. And nurses were tired, and they thought, oh no, how can we go through this again? They were still concerned about the safety and exposure to themselves and their family. They were concerned about, you know, how can I come to work and do this again? How can I take care of patients when, you know, I'm just feeling so drained after this last bout? Still concerns about some resource allocation, although it was better. I would say this time around, it was a little bit more about the staffing. As the pandemic has worn on, I think we have seen more nurses go ahead and retire. Maybe they were thinking, oh, I'll do it in the next few years, but they had that option and ability to retire. So we were seeing an increase in retirements. And we were starting to see staffing challenges with other support type staff. So our nursing assistants, our transporters, our front desk staff, just like some of the other industries have, we began grappling with those types of issues also. Nurses were concerned about the patient and family relationships. When our COVID numbers were high, we didn't allow visitors into the organization for any patient. Even to go to an outpatient appointment, we encouraged you to go alone, or only if you were a minor, or you had mobility issues, or maybe an elderly parent that was confused. Did we allow somebody to come with you to receive while you were receiving your medical care? So nurses began to worry about that relationship and how patients were feeling isolated within the hospital. And I think probably to some degree how they were feeling isolated also. I think the rays of hope during this time were really the teamwork. Nurses really came together. I think everybody in the healthcare system came together. What can we do to help support this front line? How can I bring my best self to work? What can I do to go above and beyond to help these nurses at the front line? And again, there was hope because we had the vaccine, and we thought, you know, everybody's going to rush out and get this vaccine like we were. And then from a leadership side, we were kind of dealing with all those same things. We were getting worried about the mental health and well-being of our staff. Again, how are we going to surge this staffing up for this influx of patients? Some of the ongoing communication and policy changes. How are we going to retain staff? We started seeing staff leaving for retirement or wanting to leave the bedside and go into other opportunities, which was great. But at the same time, how can we maintain that quality of care at the bedside? And then also just pride in our staff and our nurses. Like I said, our nurses show up and they work hard every day to provide the great care that we give. And then we also had some hope. We thought, with the vaccine, things were going to get better. People would rush out to get vaccinated. And as we know, that didn't always happen in many areas. So here's a story from a nurse, actually, and this is more personal because she is a nurse, but she had some family members here at our organization. So I'm going to read a little bit about her story. So my family's life was forever changed a few days before Thanksgiving when my father-in-law and mother-in-law developed symptoms of COVID. They were hospitalized at another facility, but as their health declined, we felt that transferring them to Metro was where we wanted them to be. So we went ahead and did that. We weren't ready to give up. The providers and the nurses that cared for them were both outstanding from a clinical standpoint and incredibly compassionate to mom and dad, as well as to me and my family. I called at least twice a day to check in, and they were patient and answered all of my questions. Finally, it came time to make a difficult decision to take dad off of life support. It's important to mention that mom and dad, prior to getting sick, had never been apart for 60 years. It was hard for us as a family to see them apart. Two nurses, with help from many of their coworkers, moved dad into mom's room. They moved the beds close together and joined dad's left hand with mom's right hand. At that point, they removed life support from dad, and a few hours later, he passed peacefully, holding his sweetheart's hand. The impact this gesture had on our family has been incredible. So even in the midst of all of the challenges, all of the emotions that our nurses were feeling, they still had the wherewithal to go that extra mile, to provide that hope and care to that family. I think that's just a really amazing story. And while my perspective, of course, comes from MetroHealth, I don't think this is in any way necessarily a unique situation to MetroHealth. I think nurses across the country have done things like this and taken on that extra work to provide comfort to our patients and our families during this difficult time. I've mentioned the vaccine. Also during all of this, while nurses were busy caring for, at the time, an influx of patients, we had nurses volunteering to work at our vaccine clinics. We vaccinated thousands and thousands of patients across the city, across the region, and nurses really all over jumped to pick up extra hours to get that vaccine out. And once again, I think that's just an excellent example of nurses' commitment to their profession, to their patients, and their selflessness. So fast forward, we got through that little surge, and things were kind of dying down over the summer with COVID. People were able to go back to in-person meetings. We were looking forward to school starting back in the fall in person. Many people were vaccinated now, and those case numbers just really went down. And we finally thought, wow, we can kind of get back to normal. Not that it wasn't busy, because we were catching up on a lot of things that we had put on hold during that surge. And so we were still really busy. And then a little thing called Omicron happened, and it was really tough. I think this was probably the hardest surge that we've just gone through. Mostly because we're just tired. Like I said, it feels like running marathon after marathon. And just when you start to have that glimmer of hope, something else kind of happens. So COVID was supposed to be over, or at least on a downturn. We had vaccination available to almost all ages, and boosters were being made available for 17 on ages 17 on up, but we were still tired. But once again, we showed up. We continued to provide vaccinations as I think probably one byproduct of the surge is more people realized how important it was to get this vaccination. They administered copious COVID tests as it spread like wildfire throughout the region, and continued to provide care to those that needed it most. Despite it all, nurses still gave hope and humanity to those that needed it. So one more story to share. And this was a nomination for a team award, or not a team award, sorry, a nomination for an award for a nurse, kind of like an employee of the month, from one of our coworkers. And this is what the coworker wrote. We're tired and burnt out, but we have stayed a team through it all. This morning, one of our nurses showed her compassion as she sat with a COVID positive patient in a very hot room, suffocating in the PPE, to be able to hold his hand so the patient didn't die alone. This patient's family could not be with him at MetroHealth, and I don't even think they could be on with him like on FaceTime, because they were all COVID positive too and at home. No one should have to die alone, and this is little things like this remind me why I'm still practicing and why teamwork is why I come back to work every day. So even though we've had lots of challenges, those are the type of things I think that help keep us going, and what helps keep me going throughout this, and help push me every day to help figure out ways to support our staff. I wouldn't say the challenges have changed a whole lot through the pandemic. As you can see, there's just kind of new reiterations of them, a little bit of evolving around them, but it still boils down to being a leader, showing up, listening to your staff, focusing on what their care and needs are so that they can provide the care that our patients deserve and require. So now as we move forward, how can we continue to support our nurses? So from a leadership standpoint, whether you're a nursing leader or a healthcare leader, like I said, show up and acknowledge and listen to the concerns. When I go out and round, sometimes it's just listening, because I'll ask at the end, okay, what steps do you hope I take after this, or what can I do to make this better for you? And a lot of times it's just trying to get things off their chest. There's always improvements we can make, don't get me wrong, but sometimes it's just being that ear for them to listen to and know that somebody cares about them. We need to continue to support nurses and healthcare workers' emotional, spiritual, and mental health. So the picture here I have is something really fun that we implemented in the fall. We have pet therapy here for our patients, and when we were able to bring our pet therapy back, instead of rounding on patients first, we rounded on our staff, and we've done this multiple times. And we've actually done it on night shift most of the time, because night shift sometimes gets neglected. They don't always see our leaders like day shift or even the early evening shift does. And so myself and our COO went out and rounded throughout the whole house. We do this a couple times a month, and we bring Macy, one of our pet therapy dogs, and it's such a fun experience. We also take some food and snacks with us. You would think would be really popular for the ice cream or the candy bars or the donuts, but all they care about is the dog. They don't care about us at all. So just a little something to brighten their day. We also have our spiritual health staff round on our units, especially on those units that have seen kind of the worst of it with the high mortality cases, the very sick patients. It's a lot. Even working in an ICU, you're kind of prepared to see some death and dying sometimes, but not in the volumes that we've seen it, or for as sick as some of these patients are. Offering other opportunities to our nurses. I mentioned that some nurses just need a break. It's time for them to move away from the bedside, or they need a change of scenery. So offering those other opportunities throughout the healthcare system, even if it means leaving direct patient care or moving on to another area, being able to promote those activities and opportunities, I think, is key. And also continuing to offer other opportunities for things that they might be interested, but they're not quite ready to leave the bedside. So how can we get them involved in nursing research? How can we get them involved in quality improvement projects, things like that, that hopefully can help give them a little respite from that hard work that's done every day with direct patient care, but also still, they're so valuable in looking at those processes, looking at some of the research questions and things like that that we have. Rethinking our staffing models. So right now, I think all of healthcare is under a transformation. We're really trying to focus on preventative care and keeping people out of the hospital. That being said, that hasn't always been our focus. So there's lots more opportunities for nurses to do that preventative work, do it creatively, such as through mobile health, telehealth, monitoring at home, doing more care in the home. What do those staffing models look like? What kind of support can we give them? And then also on the inpatient and hospital side, we are facing a predicted nursing shortage that we've known about, but as I mentioned, with nurses retiring, it might be a little bit accelerated. So what are those different staff models? What are those different types of support that we can give to our nurses? What technology can we use to help keep them working at the top of their scope, at the top of their licensures? Another thing is include nurses at the table. So when you're looking at some of these different programs and things, have nurses at the table, include them in that design work, ask them for their opinions. What do they think will work? Nurses, out of all the healthcare providers, spend the most time with patients. We oftentimes know what will work. Sometimes nurses are not always included in those planning phases. Also for leaders, but for everybody, show gratitude. When you go to see your doctor or interact with your nurse, or you have a family member in the hospital, make sure to thank your nurse and the other healthcare staff. It can really make their day, just to tell them a little thing that to them might not be anything. Like to that nurse, when we talked to her about how she sat with that patient that was by themselves and dying, she said, I don't deserve recognition for this. I'm just doing that. Yeah, that's just my job. That's what we do. But that's not how other people always see it. But I don't think that we always express that to our nurses. If you're not vaccinated or boosted, please do that. Please encourage your family members to do that. Not to get into the whole vaccine conversation, but I can tell you just from looking at our numbers here, this last wave of COVID that we had, we peaked around 170 COVID patients in the hospital. All were unvaccinated except for 2 or 3. So while you might still get COVID, it's going to help prevent you from being as sick as some of these unvaccinated patients. And then lastly, one other tidbit, support legislation that supports nursing and other healthcare providers. I did put a link there with some hot topics that nurses and nursing leadership are looking at. And it will also take you to a page that shows you what are some of those pieces of legislation right now. There's things that support loan forgiveness for nurses and healthcare workers, supporting mental and emotional health well-being initiatives, different things like that. So I am happy that all of you attended today. I appreciate your time. Thank you for letting me share with you. And I am happy to take any questions or comments that you might have.
Melissa, thank you so much. And thank you for all you and the frontline nurses have done over these past 2 years and continue to do as we continue to move through this experience. Probably the biggest question that we have had come in is, you've talked about all of the stressors and the challenges. And as a leader, often we are looking out to those who we are, serving. And how have you been able to take care of yourself and find those moments to address the stress that surely you and your leadership team have been under?
That's a good question, and not always the best model for that, as maybe some of my colleagues can attest to. But I enjoy being involved in the community and being involved with my profession outside of my sphere here at MetroHealth. So, remaining involved in some of the boards in the organizations that I'm in really has helped me connect to other leaders in healthcare, and just to kind of, like I said, lending an ear to staff and nurses as I do rounds. Sometimes when you're in a position like me, there's not a lot of people you can talk to or kind of have that little breakdown to. So some of the professional organizations I'm in, it's been a great network to just be able to talk to others, get their take and perspective on things, find out how they've dealt with some of these challenges. I have one of the groups I'm on, I have nursing leaders across the country, actually across the world, are on it. And so we've all gone through different surges at different times. And so it's been great to be able to bounce ideas off of them and see what's worked for them and what hasn't worked for them. And then just to commiserate a little bit. Outside of that, as Marianne mentioned, I have a husband and son and a dog. And we like to travel. So between surges, when it is relatively safe, we try to get out there and do a little bit of traveling.
Well, Melissa, thank you for being able to join us today and sharing your work. And for all of those on the call who are in healthcare, we thank you. And we hope everyone will continue to support our healthcare workers throughout all of this pandemic and what's to come. And with that, I'm going to turn it back to Marianne.
Thanks so much, Rachel. Melissa, thank you so very much for the valuable information you shared and the truly touching stories. I mean, all of you who are giving care, who are on this call, you are our heroes. You really are. I don't know that you even take time to support each other as much as you want, and to certainly pat yourselves on the back for what you do every day. So thank you. And thank you for giving us insight into that.